Okay. So, what is your program?
My program is called Health Begins Before Birth. And what it entails is I'm a clinical dietitian and I work for our local food bank. So we get referrals from usually medical professionals in the community, but anybody can actually get referred if they're in need of healthy food and healthy eating. And we provide healthy food and nutrition education during the entire pregnancy with the goal of making an impact on their pregnancy, having a healthy pregnancy and healthy baby.
What is the most rewarding part of the program?
I used to think it was when they called me and I went to visit them and held that baby and saw that glowing mother and glowing grandmother, and the baby was healthy and the mother had a good healthy pregnancy. But now I'm realizing that it's much more than that, because I'm developing a relationship with them. So they come to me at 4 weeks pregnant, and I see and talk to them every 2 weeks throughout the pregnancy, and then 2 months postpartum, I get to know them and their families' needs and lack of things that they need. And so I get an opportunity to gently educate them on the different foods that we're giving them, how to give their children snacks, different healthy snacks for their children, along with the clinical things like weight loss and diabetes. I can give them recipes. I teach them and give them ideas on how to cook vegetables and fruits and lean meats and different things like that. So if they've been receiving these foods and these recipes and these tips for 6 months, and their family gets kind of used to eating in a different way. And that excites me because of the possibility that they may continue on with this healthy lifestyle. And then their children will continue on with this healthy lifestyle. And then their children's children will, so may eventually impact a generation by breaking the cycle of unhealthy lifestyle and behaviors.
Right. What is the history behind HB3?
In Duval County, the national statistics, they did a survey. It was called the JCCI. In 2008, JCCI, which is Jacksonville Community Initiative, something like that. They did a survey and discovered that Duval County had one of the highest infant mortality rates in the state. And Florida has one of the highest infant mortality rates in the country. And our city leaders were just embarrassed and mortified. And so they came together and put some local funds together into a grant, and they called it HB3, which stands for Health Begins Before Birth. And the goal was to make a positive impact on the birth outcomes of the Duval County clients. The two statistics that they measured initially when I began the grant was birth weight, which anything less than 5.5 pounds is considered low birth weight. Anything less than 37 weeks gestation is considered premature. And so those are the two hard data outcome measures that we use to measure initially. And I'm happy to say that our average birth weight is about 7.1 pounds, and our average age at gestation delivery is 38.5 weeks.
Yay.
So yeah, pretty happy about that.
What are your ultimate goals for HB3?
Ultimately, I would really like to see it grow into, instead of just impacting the mother, you're impacting the entire family. So I would like to see it grow into some type of family resource center that's providing all of the things, the food, the healthy eating, the healthy cooking, teaching behavior modification for the children. I even have a new name for it, and it's going to be called Health Begins Before Birth and Beyond, because I think it extends far further than just during the pregnancy. And another thing that I have noticed is that if you're ever going to have an opportunity to make a change, a pregnant woman is your best captured audience, because she's not only concerned about her own health, she's concerned about the health of her unborn child. So you have an opportunity there to make an impact.
Is there anything else you'd like to add?
No, I just thank you so much for giving me the opportunity to talk to you about this. I'm pretty passionate about it, pretty proud of the program, even though it is just barely not even 2 years old.
What does a day look like for your assistant getting the food ready?
Oh, every day is a challenge, because he has a list of clients that I've talked to and counseled the day before. So he has to come in and see what foods happen to roll into the food bank that day. And he has pretty specific instructions, as guidelines, as to what balance of foods we want the family to get every 2 weeks. And so he's going to put together, say for 4 families, they each get about 70 or 80 pounds of food. And each family will get 15 or 20 pounds of fresh fruits and vegetables, depending on what we've received. And sometimes it's potatoes and onions and carrots, and sometimes it's citrus season and we get oranges and lemons and limes, and sometimes it's apples, and sometimes it's squash, and we just never know what we're going to have out there. And then they get 15 or 20 pounds of frozen meat. We like it to be lean meat. We hope that we get that in. And then it's 15, 20 pounds of canned goods and cereal and pasta. So it just depends on what he can find. He has to go out there and pull all of that, box it all up, weigh it, load it up into the HB3 van, map out his route, and then go out into the community, into their homes, and deliver the food. So
That's great.
yeah.
Okay. Cut.